Good afternoon. Thank you for joining me here today. I have Dr. Roussin here, and I thank you, Brent, for all your work and your team for your work as well. Good to have you here. This year has been like no other. COVID has impacted all of us, and certainly some more than others. And I want to offer, first of all, my sincere condolences to the families who have lost a loved one to COVID, and the many Manitobans who are battling this virus right now. Our thoughts and prayers go out to you. COVID-19 has handed us new challenges, and even greater ones than before. This virus has challenged each of us to become more resilient, more innovative, and more determined than we ever thought necessary. Our number one priority in the face of this pandemic is protecting our most vulnerable Manitobans and ensuring that our healthcare system is there for all Manitobans when they need it. Notre priorité numéro un dans cette pandémie est de protéger nos Manitobains les plus vulnérables et de veiller à ce que notre système de santé soit là pour tous les Manitobains quand ils ont besoin. And that is why, more than 2 weeks ago now, despite already having the strictest measures in the country, we implemented new public health orders to further protect Manitobans. Limiting private and public gatherings, limiting retail operations with new capacity limits, ensuring that only essential items are purchased in person. Those current orders, along with other restrictions listed under critical or red on the pandemic response system, are necessary to halt the spread of this deadly virus, to protect our most vulnerable Manitobans, to bend our COVID curve down, in short, to save lives. Today, we're here to discuss an extension of the current public health orders with some minor adjustments and some additional economic supports as well to help Manitobans, particularly those engaged in small business, during this crucial time in our fight against COVID-19. The current public health orders were scheduled to be in place until this Friday, December 11th, and today we are announcing that they will be extended until January the 8th of next year. It's crucial that Manitobans continue to limit their close contacts, only gather with members of their household this holiday season. That's going to be difficult. It's going to be lonely for many, but the best thing we can do now for our loved ones is to stay apart so that we may be together in person next year. The existing critical level restrictions will be extended, and here's why. Because they're working. They're beginning to make a difference. You're beginning to make a difference, and that is critical as we move forward. To give you an example of that, I have the week-over-week numbers with me, and I'll just quickly share these because I think Manitobans need to know that they are together making a difference. For the week ending last week versus the week before, change in cases from previous week. Canada up 14.8%. British Columbia up 30.7%. Alberta up 18.5%. Saskatchewan up 21.6%. Ontario up 9.9%. Quebec up 12.7%. Manitoba down 0.4%. This is not a victory lap. These numbers are not sustainable. We need to do more. But Manitobans need to know that what they've done has helped. It has made a difference. It has saved lives. It has kept people from getting COVID. It has helped our hospital system not to be overcrowded and overrun, our ICUs to be able to function effectively to serve people's needs, not just for COVID, but for other ailments as well. I'll now pass it over to Dr. Roussin. Brent, over to you.
Thanks, Premier. Today we are announcing 13 additional deaths due to COVID-19. This includes a male in his 40s from Winnipeg Health Region, a male in his 70s from the Winnipeg Health Region linked to the outbreak at Charleswood Care Centre, a female in her 80s from the Winnipeg Health Region linked to the outbreak at Charleswood Care Centre, a female in her 80s from Winnipeg Health Region linked to the outbreak at Charleswood Care Centre, male in his 80s from Winnipeg Health Region linked to the outbreak at Charleswood Care Centre. A female in her 80s from the Winnipeg Health Region. A male in his 80s from Southern Health Santé Sud linked to the outbreak at Greendale Heights Estates. A female in her 80s from Southern Health Santé Sud linked to the outbreak at Rest Haven Care Home. A female in her 90s from Winnipeg Health Region linked to the outbreak at Holy Family Personal Care Home. A female in her 90s from the Winnipeg Health Region. A female in her 90s from the Winnipeg Health Region linked to the outbreak at Park Manor Care Home. A male in his 90s from Winnipeg Health Region linked to the outbreak at Misericordia Health Center's transitional unit. And a female in her 100s from Prairie Mountain Health Region linked to the outbreak at Fairview Personal Care Home. I'd like to extend our condolences to the friends, families, to the caregivers of these individuals, to these Manitobans that we've now lost. And again, we're announcing the loss of too many Manitobans daily here. Our current 5-day COVID-19 test positivity rate is 13.7% provincially. It's 14.6% in Winnipeg. 325 new cases of the virus have been identified as of 9:30 a.m. Today we're announcing that we're extending the public health orders from December 12 until January 8. This means the orders will be in effect through the holiday season. Our numbers are still too high. This is now not the time to let up. Our modeling and projections have shown that the red or critical restrictions have helped us avoid that worst case scenario, that our numbers would be much worse at this point, but for the restrictions that we have in place. And that's why we're extending these orders with some minor adjustments before the holidays to keep us on the right path through those holidays. Adjustments to the orders include providing clear direction for the operation of food banks, allowing thrift stores to open with some limits, opening acupuncture and manual osteopathy practices, adding school supplies as an essential item, and providing more guidance for outdoor activities. We're also making some seasonal exemptions to allow for the purchase of holiday-related items such as decorations, garlands, religious items such as menorahs. Drive-in events are allowed, but are a temporary and time-limited measure. This section of the orders will be subject to compliance. If we find that drive-in events are not being restricted to households within the same vehicle, or people are getting out of their vehicles at these events, the orders will be subject to change. A full list of the changes available in a news release. We know that these orders have been challenging, some more so than others. We know that it's going to be challenging going into the holiday season, that our holiday season is going to look much different than normal for many Manitobans. But we know that we require these restrictions based on the current numbers. We need to keep our healthcare system open for everyone who needs it. We need to continue to stay home as much as possible, and that's to protect the most vulnerable and to ensure our healthcare system can be there to provide that much needed care. And so what does these new restrictions mean for our current and ongoing approach? It's really the same issue as before, is that we need Manitobans to step up, and we need a high level of compliance to our public health orders from Manitobans. When these conditions are met, our interventions are shown to be successful, we can expect the current restrictions to follow the same pattern with widespread public buy-in. Our message to Manitobans today is that our current very restrictive public health guidelines are necessary to rapidly manage the case numbers that we're currently seeing. We've made minor adjustments to ease access to some goods and services, but right now the public has a very significant role in determining how successful these measures will be. This means that Manitobans will continue to work together to reduce the spread of COVID-19 in this province. With high levels of compliance, we'll start seeing these numbers improve, and then we can once again get back to some of the things that we enjoy and love, such as visiting our loved ones in personal care homes. We want to be able to keep our kids in school and have them attend their activities. We want to be able to gather with our loved ones again. And this is all requisite on our ability to bring these numbers down. Right now, we do need to bring down our numbers of contacts. We need to stay home as much as possible, going out only for essential reasons. But if we follow these public health recommendations and these restrictions, we're going to continue to see these numbers come down. We certainly have news of a vaccine is a glimmering light for us, but it will not immediately change our need for public health measures. We need to stay on top of these case numbers for the time being, and together we'll start bringing these numbers down once again. So thank you, and I'll pass over to the Premier.
Thanks very much, Brent. We recognize the significant personal and professional sacrifices that all Manitobans have made in the face of this pandemic in order to protect one another. But they are beginning to work, and they are protecting our friends and neighbors and family members. And the extension of these and modification of these public health orders announced today, coming into force this Saturday, December 12th, will only work with your cooperation. They'll only work with your commitment, and the commitment of all Manitobans to make them work. We have been working, we've been working really hard, and we'll continue to work side by side with all Manitobans. I want to make some comments now specifically, though, about Manitoba businesses. Our Manitoba small business community is the vital backbone of our economy, and the business people in our province, business families, mom and pop operations, differing sizes of businesses that offer services and goods to us have been placed in a tremendously difficult situation at a tremendously challenging time of year. One where they had high hopes, of course, of offering you the things you need and want in the holiday season. We will continue to work with our Manitoba small business representatives. We've had dozens and dozens of discussions and meetings that we value their input. But we know now that our small business people, to some degree, can't offer the jobs they'd like to offer to Manitobans. They can't offer some of the services Manitobans rely on. And we know that we'll never make up for all the lost opportunity and profit that businesses might have gained through this time of year, and normally do. Nonetheless, we have designed a bridge program to help bridge our small businesses through this time, through this tough time. Direct support, simple application process to any Manitoba business, and also, I should mention, nonprofits and charities as well, that have been forced to close their doors as a result of the COVID-19 public health orders that came into effect originally on November 12th. I want to share with you that since online intake began on November 16th, more than 6,300 businesses have received over $31 million in direct financial support. These are not repayable loans. These are grants. In other words, they are for the business people, the families, and the individuals involved to use as they see fit without repayment. I should mention that these businesses include a wide range of services: restaurants, bars, recreation and sports facilities, museums, theaters, charitable organizations, nonprofits, faith-based organizations, any that had to close their doors as a result of these public health orders. The people that have made our small businesses work throughout our lives are the ones who are making great sacrifices now to protect your health and to protect the well-being of our community and the safety of our healthcare system. And I wanted to say today especially that we have, as a direct result of a lot of the input we've received through our members of the Legislative Assembly of all parties, made a decision to change and broaden the supports. Not all businesses operate a storefront, and I'm one who didn't when I started my first small business. It wasn't a storefront type of business. But these businesses are making sacrifices too. And so we're going to expand the Manitoba Bridge Grant to include home-based businesses who've seen their market and their source of income greatly reduced because of public health orders. We call this the second stream of the Manitoba Bridge Grant program, and it'll open its intake tomorrow. So I wanted that news to be out there for Manitoba small business people so they can use this program to support them through this tough time. This will provide up to $5,000 in support this year to home-based businesses. This might include, but not be limited to, people like events planners and photographers, artists, tradespeople who don't operate a retail location. For a full list of criteria and to apply through a simple application process, just visit manitoba.ca/COVID-19, click on Programs, and click on Manitoba Bridge Grant. For assistance to complete the online form, applicants can contact the Manitoba Government Inquiry Line, and that's 204-945-3744, or you can call toll-free at 1-866-MANITOBA. The deadline for applications for both the first program, which we are extending now 2 weeks for the application process, or this new additional program, is the end of year, December 31st, 2020. We do have the strongest supports for small businesses of any province in the country. We know that we value you and we want to help you get through this time. And so we're advancing this financial support now so that we can help you bridge your business through this challenging time. I want to add to those of you who aren't in business that as we approach this normally more festive season, I'll put it that way, I want to encourage all Manitobans to shop safely and to encourage you to take a look at shopping online and shopping local. And many of our businesses have adapted tremendously well, and they're able to do things like curbside pickup and delivery to your home or your place of work, in fact, to get you the gifts you might want to buy for someone special. The best thing we can do for our businesses, for our healthcare system, for our schools, for our vulnerable communities, for our loved ones, is bend this COVID curve down. We did it once, we can do it again. We need everyone on Team Manitoba. It's a team effort, and we all have a role to play in protecting ourselves and our loved ones in our community. This is a time for us as Manitobans to step up and play that role. We know that most Manitobans are following the doctor's orders. We are, as you know, we stepped up enforcement, and we're continuing to have to ticket and fine individuals who aren't on the team yet, but we encourage them to join the team now. These last few weeks have not been easy, to put it mildly, and the next month will not be easy either. But I am confident that if we continue to work together, we can and we will get back to beating COVID as we did in the past. When we were abiding by the fundamentals, we were beating COVID. Some of us lost our way. Now COVID is beating us, and we need to get back to the fundamentals, as Brent has outlined, as Lynette Saragusa has outlined so many times for you. Lorsque nous respections les fondamentaux, nous battions COVID. Alors certains d'entre nous ont perdu notre chemin. Et maintenant, COVID nous bat. Nous devons revenir aux fondamentaux et piller notre cœur COVID maintenant. It's crucial that we follow these fundamentals. Stay home. Only leave your home for essential purposes. Stay home when you are sick. Stay home if any member of your family is sick. Don't socialize with people outside of your household. Wash your hands, cover your cough, practice physical distancing, wear a mask, and be kind and call somebody who's lonely. Happy to take your questions.
Thank you, Mr. Premier. Up first this afternoon, the Winnipeg Sun, Scott.
Good afternoon to both of you. Scott Bill, Winnipeg Sun. Dr. Roussin, I asked you the question during the technical briefing, but I'll ask it again. Just wondering, numbers, I guess they've plateaued a little bit. Some of them are going down, but they're not where you want them to be after 2 weeks, after a month since other restrictions were put in place. I guess why do you think extending these restrictions will lead to lower numbers when we haven't, maybe seen it as quickly as first thought, I suppose.
Yeah, we haven't seen it as quickly as we wanted. That's definite. But we are seeing that trend, and we certainly, from our modeling numbers, saw that it made a significant difference. And so we're certainly not in a position to, loosen significantly any of these restrictions. We know where that will take us back to that worst case scenario. But we'll, need these restrictions on. With good compliance with these restrictions, we're going to see those numbers come down, and so this is where we really need to be. And I'll just in my notes there, I mentioned 325 new cases. Today, it's actually 245 cases. Just to correct that.
If I could, I'll just add, Scott, that numbers are pretty telling. BC has very limited restrictions. They're looking at adding more. But week over week, their numbers went up by almost 31%, and ours were flat. It's a fair indication that these restrictions are doing part of the job we need done.
A second question, Scott. Okay, we'll move on to CBC Radio Canada and Mathieu.
Hi, my question is for Mr. Pallister. Mr. Pallister, 20% of Manitobans say they are going to ask people over Christmas according they are survived. Do you have a message for them?
I would encourage all Manitobans to remember that we can get together next year safely. Our hope is that we have a vaccine available. I'll have more to say on that tomorrow in respect of our planning and prioritization work that has been ongoing for some time. And I would just encourage Manitobans to be patient and thoughtful and considerate of others, and make sure that we don't, there's a difference between COVID and COVID fatigue. We all feel COVID fatigue. COVID causes COVID fatigue. We can't let COVID fatigue cause COVID. So follow the doctor's orders, be safe, keep those around you safe. We'll get through this thing together.
Do you think will be freeze and fine with the extension of the red card?
I'm not sure I got you there, Mathieu. I think you said fines. Did you reference?
Yeah.
Yes. Yeah. No, we've sadly seen an increase in group size infractions, some of those in households. Businesses, on the other hand, the number of fines our inspectors are levying is going down. Our businesses seem to be working very hard, as they have, to comply. But deterrents are important, and we'll continue to have a system of enforcement in place. And I encourage Manitobans to listen to the good doctor here. He's right, and he is focused, as I am and as our government is, and as most Manitobans are, on getting through this and saving lives in the process.
We go back to the Winnipeg Sun for one more question. Scott.
Hey, yeah, sorry, my call dropped. Second question, and I hope it didn't get answered or wasn't asked before because I wasn't on it for a bit. The exemption for drive-in services, over the weekend, the court shot down one church's attempt to allow them. Why allow them then, even if the courts are backing the public health orders? Why allow those drive-in events if you do believe that they are unsafe?
Yeah, and so we've when we set out with this circuit breaker, these very strict measures, this was one of the measures that we somewhat reasonable. So we still are concerned that when you gather large people in the same area, we need strict adherence. So we need to ensure that it's going to be only household members in those cars, and people aren't getting outside of their cars. We're going to watch this very closely, and if adherence isn't good to the orders, then we could change course on that. But we had those very strict measures in place. We wanted to provide something. We've listened to Manitobans, and this had been in the on the deliberations for a while.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, you've said before that vulnerable people are drivers in Winnipeg of the spread of COVID-19, and the community advocates, they say there's not really any effective public health messaging to get to these folks. People, they may not be literate, they may have addictions, they may have health issues, they don't have access to information the way a lot of other people do, particularly in the Point Douglas Health District. What's public health doing specifically to reach these people where they are?
Yeah, and so we have a number of outreach measures. We have testing going on, rapid testing in those areas. Public health engages with community groups to try to reach out to these groups. We've expanded our alternative isolation accommodations because we know in these settings it's very important to be able to have people the support they need to be able to isolate effectively. So there's a lot of that's the kind of specific work that's being done, but we're continuing to to look and see what more can be done.
Thank you for that. Next one's for Mr. Premier. Mr. Premier, we saw in the modeling on Friday that back in late September and early October, the real case numbers were off the charts of the worst case scenarios for where the growth would be. You had said months and months ago that projections aren't very helpful. But what do you think of the idea that had you, Dr. Roussin, come out and told the public, look, we're screwing up way worse than we even expected, the public may have actually listened more and adhered more to the orange restrictions?
Well, actually, let's put this in context. When I was answering your question about postulating on the future, we were talking, I think, in early April, if I recall, Bartley. To be fair, that was pretty much early days for COVID. And so when I reference hypotheses, I was echoing the comments of many noted epidemiologists and experts who said it was very, very big, plus minus, to get into speculating on numbers. That being said, we remained at work throughout the entire summer preparing for the onset of the second wave. Our task force, our various subcommittees continue to work diligently. And so what you're seeing now, despite the high increase over the last number of weeks, is the result of that. Shorter wait times to get tested, faster turnarounds to get your test results back. Our system for tracking is standing up, whereas in other provinces falling apart. This didn't just happen by accident, it happened as a consequence of a tremendous amount of focused effort by Dr. Roussin, by his team, and by others throughout our government operations. And so, yeah, we're all disappointed that the second wave is here, and we're all disappointed that we've got COVID in our province. But I would want Manitobans to know that by doing the right things here, and by listening to Dr. Roussin and effectively following the public health orders, we're beginning to get back in the fight against COVID in a successful way.
From the Canadian Press, Steve.
Oh, hi. I have a question about the drive-in services being allowed. These are still essentially public gatherings, and I know the new rules will say they're allowed, but no one's to get out of the car. It's household members only in each vehicle. How much will this be enforced? Will officers have to attend some sort of church services every weekend from here on in?
Well, it's certainly subject to that type of enforcement, but we've heard from Manitobans. We've engaged leaders, in the faith-based communities, and everyone's on board. They know how important it is to adhere to this, and we've had this on the table for some time now to be able to move in this direction. But we'd still say it's really important that we adhere to this. We cannot afford Manitobans to be gathering in large numbers right now. We need to continue to get these numbers down.
And my second question is about outdoor activities, Dr. Roussin. You've stressed the need and the benefits of being outdoors for physical and mental health safely. But there's a dividing line there, as I understand it. Community hockey rinks, for example, aren't going to be open. Warm-up shelters aren't going to be open. So it's people who go outdoors will have to do it sort of on a self-sustaining, little support basis.
Yeah, and I mean, so this is a challenge when we get into the specifics of orders. We didn't really have much choice. We have to do whatever we can to minimize the risk to Manitobans, but we know there's a tremendous benefit to staying active. We know there's a tremendous benefit physically and mentally to being out and enjoying the outdoors and being active. So we wanted to clarify in these orders that activities that involve your household outdoors certainly are okay. If you are outdoors amongst others, you have to have that physical distancing. The group size limits of 5 still are in place, but things where people could gather indoors, especially crowded places, we still need to avoid that.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin. How will the Winnipeg Jets be allowed to train? Like, what will be the rules around that? When can they start? And when the word train is in it, does that mean a full practice?
So this is, a lot based on the very robust plan that the NHL and its teams have put forward and has already been proven to be safe. So they will be able to train, to practice, to take the ice. All self-isolation requirements are required for these for the team. So much of the quarantine that we had in place from last year is still in place. The training, the self-isolation allows training. So this is back and forth to the training facility, back to residents with private. So there's a lot of safety guards which have already been proven to be effective through last season. And so it really poses no risk to Manitobans. And then there's a lot of protocols in place to have this very safe for the team.
Mr. Premier, this is actually very timely. My 8-year-old asked me this question this morning. How can the Winnipeg Jets practice and play, and I'm not allowed to? What do you want to say to them, Mr. Premier, although children who can't play hockey?
I want to say that I asked my mother one time why she chose, after teaching multi-grade schools and classes for so many years, she had the chance to choose a grade, and she chose grade 3. And I asked her why, and she said because 8-year-olds are perfect. And that's a perfect question for Brent to answer. Thanks, Jeff.
Yeah. So the issue there is just on the safety, right? So we're dealing with a league that has purchased its own testing, has very strict requirements for routine testing. They have very strict requirements for self-isolation and quarantine that we've reviewed, and it's already been proven to be effective. And so when we look at these things, we see really no risk to the public in Manitoba. We see some benefit to having something for people to be looking forward to during these difficult times. So certainly it's not the same protocols that could be in place for an 8-year-old hockey team.
From City News, Stephanie.
Hi, Dr. Roussin. Stephanie Lasuk from City News. I wondered if you could kind of paint a picture for Manitobans. What do the ICUs in Manitoba look like right now, and what are you expecting over the next couple of weeks?
So, I mean, there's a lot of strain in the ICUs right now. I don't have the updated, vacancy number. We know that we have, 38 active cases in the ICU. We know that they are running at over capacity, over pre-COVID capacity. That capacity to expand is still there, but it always comes at a cost. Something else has to stop being done in the healthcare system, and we know that there's elective surgeries that have been postponed, and so all of this is a factor. So we're seeing increasing demand on healthcare services, admissions to hospital, admissions to ICU. increased demands on our healthcare providers, and all of this lags behind the high numbers we've been seeing. So the high numbers that we saw, 2 weeks ago are starting to show in our hospitals. As soon as we can get these numbers down to more manageable levels, we'll start seeing that demand decreasing. We'll start being able to get back to the healthcare services that we all need.
Okay, and I wondered if you could just reiterate where a lot of our cases are coming from currently. I know you mentioned part of it was from workplaces as well. How much are we really seeing from people's workplaces?
Well, we see some transmission in various work settings. We're seeing a lot of household transmission. And again, a lot of our transmission is what we would call community spread. So in a significant proportion, province-wide, over a third, in Winnipeg up to 50% sometimes, we're unable to link the cases. And so it's really why we've needed to take these broad measures to try to bring down this transmission.
From CHVN, Taylor.
Hello, good afternoon. When it comes to the drive-in services, let's say someone leaves their car for any reason, whether it's they have to go to the bathroom or all the way together in a group, how will it be decided if someone gets a ticket and who will have to pay for it?
Yeah, so I mean, these orders apply to organizers, to individuals. And so really this is the concern that we have about it. When you group that many people together for that long of a time, is there an increased risk of people getting out of their cars for various reasons? And so these are the concerns we voiced. We've gotten feedback that they are able to be controlled, that these risks are they're able to make these things safe for people who attend there. But we're going to be watching it very closely. We know that there's a lot of fatigue out there. We know that there's a lot of strain upcoming holiday season. So we wanted to find some things that we could reasonably do in a safe manner for Manitobans. And this is one thing that we've heard back, but we'll have to watch it very closely.
And along the lines of the holidays coming up, they're asking people to stay home for Christmas. People are going to be able to see their parents, sometimes their kids. That's all going to be very difficult, and not everyone is going to want to follow this. How do you suggest people have these kinds of conversations and say no to people gathering?
All those people in your family that you normally gather with, if you find alternate ways to gather this year, you're protecting them, right? You're doing your part to protect the people you love. And so gathering right now, we have a 13% test positivity rate. Gathering outside your household puts yourself and all those people at risk. And so that's my message, is if the best way to protect yourself, the people around you, the people you care about, the people you love, is to not gather right now. There'll be time for that, but we need to protect ourselves right now.
Taylor, in the world of COVID, the best present that you can give someone you love is to not be present with them, to give them the chance to be with you next year, for you to have the chance to be with them next year.
From the Winnipeg Free Press, Larry.
Is the initial Manitoba Pfizer vaccine site going to be located in Winnipeg, and will, presuming PCH workers will be among the first to receive the vaccine, will the province be flying in folks from Thompson or bringing in people from Brandon and other locations to get the two separate doses?
Yeah, this is very good question, Larry, and it's an exciting thing, I think, for many Manitobans to know that we have some vaccine on the way. I'll share more of those details with everyone tomorrow, but I wanted to give you some good news today. We got confirmation late last night from federal officials. These are our senior partners at the federal level in several different departments. And they informed us that the Moderna vaccine, this is the one that doesn't require the super freezer, allocation for first quarter has been boosted by 15% for Manitoba to take into account the disproportionately large at-risk Indigenous population that we have in Manitoba. That's great news. I'll be sharing that with Indigenous leadership later today, that information. But that's a tribute to their work. It's a tribute to the work of our committee. It's a tribute to our partners at the federal level. We sincerely appreciate it, and we know that these vaccines will be appreciated in the communities of our province where people are clearly at higher risk, where vulnerability is very real. So again, I say thank you to all those involved in making sure that this happened. We've been pushing for this for some time. There is more to do, and this will not solve all our problems, but it is a positive thing to know we've moved from 66,000 allocation, per cap allocation on Moderna in the first quarter to 75,600. So that's a nice increase, and I'm knowing that the people of our Northern Indigenous, and this could include Métis communities as well, that this is going to be well appreciated.
What date can we expect to get a vaccine priority list for the first December round of Pfizer doses?
Tomorrow.
From Global, Joe.
I only had one question.
Hi there. I'm looking for some more clarity on outdoor gathering rules. People are going to be looking for some workarounds. So would a place like a garage be allowed under the rules? Can you gather in a group of 5 in a garage? And if so, would you need to wear a mask?
Yeah, and so right now one's property is defined as their residence in the orders. So you couldn't have people over that are not household members in your garage. You couldn't have them in the back for a fire. That all is your residence. And so again, getting out and about, staying active is great, but we do need to avoid gatherings. Outside of residences, the gathering limit remains at 5, although there's not a lot of places to be able to gather now. So we want people to find ways to stay active, try to enjoy that winter, try to keep connected with people virtually, but we just have to avoid gathering with people outside your household.
Thank you. And can you explain what targets, like what specific numbers you're looking to hit over the next few weeks before January 8th, before you can make a decision if we're going to ease up by then?
Well, it's really difficult to list just specific targets. We do look at a number of things, right? Our test positivity is nowhere near somewhere where we could loosen our restrictions. We need to be getting that test positivity back down towards that 3% range, not necessarily using that as the specific target, but we're just right now to loosen things. So we need to see absolute cases come down. We need to see that test positivity come down, and then we have to have enough time to ensure that that's resulting in a decrease in strain on the healthcare system.
From the Brandon Sun, Michelle.
Good afternoon. Premier Pallister, are you able to say how many more businesses you're expecting the bridge grant expansion will help and how much money you're estimating you'll spend on it?
Well, Michelle, thanks for the question. There are literally tens of thousands of businesses that might apply, and the qualification criteria are fairly clear. So I'll be able to tell you, I think, in fairly short order, based on the applications that flooded in on the bridge program phase 1. A lot of them came in the first few days. I should be able to give you actual numbers rather than guess at them as early as next week, I would think.
Excellent, thank you. And Premier, you also mentioned Christmas will be lonely for some. Can you offer suggestions on ways to help combat that loneliness for Manitobans who may already be experiencing that state, which will likely be exacerbated heading into the third week and fourth week of December?
Yeah, Michelle, I've been criticized for breaking down too often, so I'm not going to start talking about seniors at Christmas. I was raised by my grandparents. Every time I start talking about seniors, I think of them at Christmas, and it breaks me up. So don't confuse my willingness to put my heart on my sleeve with a lack of resolve to fight COVID. I will say, please reach out. Don't let people feel alone at this time of year. Do that. That'll be much appreciated.
Our final reporter this afternoon from CJOB, Will.
Good afternoon to both of you. Dr. Roussin, considering we are going into the holiday season now, can you talk to us a little bit about enforcement measures, since this is typically a time when people are going to want to gather with families and friends, etc. How do you intend to rein that in?
Well, these orders are there for to be a clear message to Manitobans on the importance of it. We've seen our numbers at least move in the right direction. We're not where we need to be yet. We saw where we could have been without the restrictions, and we know that it's been challenging. And we know going into this season is going to be even more challenging because people that normally gather during this time. But our message is clear. The reasons for that message are clear, and the restrictions are there and are fully enforceable. So gatherings with people outside of your household certainly could result in fines. And we do that because we know how important it is to protect Manitobans, and it's a vital time that we're coming up to now.
Well, I'll just add to Dr. Roussin's comments and say quickly, it's the old adage, short-term pain for long-term gain. Conversely, short-term gain for long-term pain. And we can't let up in our battle against COVID. If we do, the snowball effect we've already seen happen in the past is something that could happen again, and nobody wants that. So some short-term pain for sure through these holidays, but the long-term gain is worth it because we can be together next year and we'll have something to really celebrate.
Okay, thank you both for that. Dr. Roussin, I'd like to ask you now about public health messaging when it comes to vaccine safety when it comes out. Some people are going to be hesitant to take it because it's new, or they want to wait maybe a certain period of time to make sure it's safe. How concerned are you about people being nervous to take the vaccine, and what would be your message to those people?
So I think this, having a vaccine, having an approved, soon hopefully to be approved vaccine this soon is that glimmering hope I think we all need. It's not going to change our overall public health messaging immediately, but it is that hope that we need. But just like any vaccine, we need substantial uptake of the vaccine. And I think that there is going to be a strong demand for this vaccine, and we're going to see that very early on with the scarce, relatively scarce amounts that provinces are going to get at first. There's going to be a lot of demand to be in line for that. And so we're going to have to choose the priority groups. But we expect to have enough vaccine in the upcoming calendar year for all Manitobans who want it. And we're expecting a large proportion of Manitobans to get it. And it's the best way to protect yourself and protect the people around you.
Thanks, Brent, again for all your work. And just to close by saying, remember that vaccine isn't here yet. When it comes, it'll come in small numbers. And so be patient and be diligent. And remember what Dr. Roussin and others have said to you about following these public health orders. It's so, so critical. We can't let our guard down. We cannot stop fighting this insidious enemy that is COVID-19. And we will get through this together. So thanks everyone for watching and for your questions.